Hi, my name is Kelly Patrick, and I'm the manager of the healthcare technology team at Omdia. We've been busy assessing the impact of COVID-19 on several of our major healthcare markets to provide actionable insight to our core clients. We'll be continuing to update you on our findings and adjustments to market projections as we dive deeper into the full impact of the disease. The novel coronavirus was first discovered in December 2019 in Wuhan in China. To date, there's been over 3.5 million cases globally and sadly over 240,000 deaths. Initial cases were limited to the Asia Pacific region, but have since vastly spread to North America and Europe, and now to more emerging regions that have much poorer healthcare infrastructures. Most of those affected by COVID-19 will experience mild to moderate respiratory illness. However, COVID-19 could lead to serious illness for elderly and those with underlying medical problems. The sudden surge in patient numbers has subsequently placed great strain on healthcare systems, and most notably an increase in the demand for devices that offer respiratory support, including ventilators. The surge in patients requiring ventilators shook the industry, with a mass scramble for ventilators from all active providers. Existing companies reacted as best they could, ramping up ventilator production, but this was exacerbated by the shortfall in supply in components after the lockdown in many countries that are renowned for their manufacture. However, it's clear that the demand far outweighed the production, triggering several action groups. Of note, the UK Government Ventilator Challenge established a consortium of companies that proposed ventilator blueprints to help uplift the number of ventilators available to the UK population. This triggered a mass response, which in turn resulted in a number of deflated manufacturers after the realization that the initial number of ventilators projected was far greater than what was actually needed. It also seemed to escape the news that the introduction of new ventilators would come with the need to install the new devices and train those staff, which in the current climate would be extremely difficult. The already dwindling staff would be overstretched to learn how to use new machines. The new machines would also be unlikely to be interoperable with their existing healthcare solutions. Despite this, overall shipments of ventilators have significantly surpassed normal projections. Globally, Omdia has projected an uplift of 71% in revenues for new shipments of ventilators in 2020. Most growth is projected for the North American and European regions, where cases have been extremely high and demand has increased in both existing facilities and pop-up healthcare facilities to help support that increased patient population. Part of the problem in preparing for a pandemic such as COVID-19 is the uncertainty on how the virus is transmitted, how it affects the body, and how long it lasts. Initial questions are starting to get answered, and the efforts to develop an immunization and mass produce that for the global population is now within reaching distance. Without a cure or immunization, the death toll will continue to rise, and healthcare systems will need to deal with this accordingly. It's clear that several countries were not prepared for such a pandemic, and mass purchasing has placed great stress on already stretched healthcare budgets. It's likely that pandemic will change decisions moving forward as to how healthcare systems will be safeguarded. In terms of the ventilator market, most growth is projected for ventilators used in high acuity settings, in addition to those in subacute settings such as general wards. The level of functionality of ventilator required for the sickest patients is very high, demanding high-end devices. To prevent admission to the ICU, demand for ventilators to help with breathing difficulties in the lower acuity settings has also increased. The anticipated increase in ventilator shipments will be more than enough to fulfill ventilator demand for both 2020 and 21. The sheer quantity will result in the market being flooded with ventilators this year. So for 2021, Omdia projects a significant decline in ventilator demand, with initial projections of a global decline of revenues of 53% in 2021 compared to 2020. It's likely that the market will become even more price competitive, with the surplus of vendors active and competing for share. So what are the key learnings from the pandemic? With the economic climate as it stands, everyone will have to take some level of responsibility to reduce the risk in the future. All countries will no doubt review their strategy to stockpile critical medical resources for future pandemics. Manufacturers are also likely to review their preparedness to support such a demand in the near future. Attention in the more mature markets is likely to be to improve IT infrastructure to allow better connectivity among devices. This will lower the burden on staff by reducing the amount of administrative work that they are required to do, also allowing them to provide more time and focus on their patients. Additionally, the ability to connect remotely with other systems will enable quicker access to records, providing them with more accurate diagnosis and treatment. As a consequence, the demand for connected and interoperable solutions will increase post-COVID-19 to enable more efficient and safer healthcare facilities. Overall, an upsurge in remote monitoring and patient assessment will be likely to cater for that increasing number of patients with long-term conditions who are unable to access a healthcare facility. It is expected that that will become the new normal. Omdia will continue to closely monitor their developments surrounding COVID-19 and provide timely updates as needed for information and guidance. Stay safe, everybody.